Time in the operating room, about 25 minutes for treating both eyes. The laser component of it for SMILE, about 25 seconds. For LASIK, because it's the two lasers, about 20 seconds each, with sort of treatment time in between. So, you know, it's pretty quick. Most people are surprised by how quick it is.
Most people are going to be good enough to drive by the next day, although we do ask people to wait until they've come for their post-operative appointment for us to check that everything is okay and they meet the driving standards. The only exception would be with PRK laser. Sometimes it may take a week or two for patients to achieve driving vision levels with PRK.
Time off work after laser is really a bit variable, but most people are feeling pretty comfortable the next day right after surgery. Most people will wake up with no discomfort whatsoever and pretty good vision.
Depends a little bit what work they do. If it's involving a very dusty or dirty environment, we may ask them to take a few days off.
Competitive sport and training after laser vision correction is something that should be possible within a week or two. With LASIK, where we create a flap, we'd be inclined to recommend 2 weeks off that sort of activity. With SMILE, where there's no flap and the eye is much more structurally intact, we're happy that people interact in that sort of way after a week or less.
There are medicated eye drops which the patients will need to use for a week after the surgery, and some patients will also want to use artificial tear drops for a while after surgery, and that sometimes can be required for a few weeks afterwards.
Although LASIK and SMILE are carried out under local anaesthetic so that people are aware to some degree of what's going on, neither LASIK nor SMILE are uncomfortable or painful at all during the operation.
Laser vision surgery is not completely safe. Every operation carries with it some risk. But if we balance the risk and benefit, it's probably one of the safest procedures that can be done. We can never guarantee perfect vision after laser vision surgery, but the vast majority of patients will have excellent vision, so much so that it has the highest patient satisfaction rate of any procedure that's currently done, above 95%.
We would generally expect the results of surgery to last for a very long time, and the vast majority of our patients will keep good distance vision, probably for decades. However, some patients, their eyes can go through further natural changes as the years tick on, and we do occasionally find that people develop short-sightedness again.
If you're a contact lens wearer before surgery, we need for those contact lenses to be removed until the eye has a stable prescription that we can measure, so it's not changing. So for soft contact lens wearers, we'd like to have the lenses out for a minimum of a week, in an ideal situation perhaps 2, and for hard contact lenses, it can be considerably longer.
There isn't any specific upper age limit for laser vision correction. Once people get to the age of about 45, the ability of the lens inside the eye to do the extra focusing work required to let you see up close diminishes.
In some circumstances, there are other options which may prove to be better for that individual patient. For example, lens exchange. We remove the natural lens of the eye and put a lens implant in its place. When we're talking about laser and doing things to the eyes, it's normal to feel anxious about it. But you know, when people come in, they're also excited, and we can generally allay their fears, and of course we take very good care of them and make sure everything goes just fine.
I often get asked would I have laser vision correction done, and that's easy because I already have. And I've also operated on a number of family members, all of whom have had great outcomes, so I wouldn't hesitate.